July 2, 1944, Normandy, France. A concealed field hospital beneath the fortifications near Cherbourg. After days without daylight, the cave entrance felt blinding. When Dr. Schwester stepped out from the underground medical shelter, her white coat hanging awkwardly from exhaustion and weight loss, she lifted her hands instinctively in surrender. Her eyes narrowed against the sun, a world she had not seen since the siege tightened around Cherbourg. Only hours earlier, deep inside the rock-hewn corridors, she had voiced her certainty to her fellow nurses. The Americans could not possibly possess the vast medical resources they claimed. Such stories, she believed, were little more than psychological warfare meant to weaken German resolve. She was wrong. Behind her, 8 other German army nurses emerged one by one into the open air. Together, they became some of the earliest German medical personnel taken into American custody during the Allied invasion of France. For weeks, they had worked in an improvised hospital carved into stone, treating wounded Wehrmacht soldiers under conditions closer to pre-modern medicine than to 20th century warfare. Illumination came from candles. Morphine was rationed drop by drop. Bandages were boiled, dried, and reused until the fabric nearly disintegrated. What awaited them beyond the cave was not interrogation or punishment, but something far more destabilizing. Within hours of their capture, the nurses were exposed to American medical units operating with an abundance that directly contradicted everything they had been taught, professionally and ideologically. Fully equipped surgical wards, refrigeration units for blood and plasma, antibiotics still unknown to German field medicine, and supply chains that appeared inexhaustible. The contrast was impossible to ignore. Colonel Richard P. Johnson, commanding officer of the 45th Evacuation Hospital stationed near Lamb, observed the captured nurses not as enemies, but as colleagues bound by the same oath to preserve life. Under the protections of the Geneva Convention, enemy medical staff were not prisoners of war in the traditional sense. Within days, these women would be repatriated. 16 German nurses in total were exchanged on July 2nd and again on July 9th, 1944.
Yet before their return, they witnessed American wartime medicine at work. They saw pharmaceuticals they had only heard about in rumors. Surgical procedures performed with speed, sterility, and technical confidence beyond their formal training. Equipment that eliminated improvisation. Systems that treated mass casualties without collapsing into chaos. The physical captivity was brief. The psychological impact endured long after. This confrontation with reality did not begin in Normandy. More than a year earlier, on May 13, 1943, under the unforgiving sun of Tunisia, another collapse of assumptions had already taken place. When General Hans-Jürgen von Arnim surrendered Axis forces in North Africa, the capitulation included not only combat units, but thousands of medical personnel, doctors, medics, orderlies, and nurses of the Deutsches Rotes Kreuz, many of whom had served alongside Rommel's Afrika Korps throughout 2 years of desert warfare. Among those captured was DRK nurse Ilse Schultz, who had been awarded the Iron Cross Second Class in April 1943, an honor bestowed upon fewer than 20 women during the entire conflict. Another decorated nurse, Greta Falk, also a recipient of the Iron Cross that same month, kept detailed notes during captivity. These observations, later uncovered in German military archives, offer a rare, unfiltered account of the experience. Her words were precise and restrained, yet unmistakably revealing. The Americans discarded more medical supplies in a single day than German units received in weeks. They possessed drugs unavailable to German hospitals, treatments discussed only in theory, and logistical systems immune to the shortages that plagued the Axis war effort. For these nurses, trained within a framework that emphasized German technological and organizational superiority, the exposure to Allied medical practice was not merely educational, it dismantled a worldview. The encounter did not just redefine their understanding of medicine, it quietly eroded the ideological certainty that had accompanied them into the war. By the time they returned to German lines, they carried more than memories. They carried evidence, seen firsthand, that the narrative they had trusted was deeply flawed. The collapse of Axis resistance in North Africa culminated in one of the most extensive mass surrenders of the Second World War. When organized fighting ended in Tunisia, Allied forces took custody of an estimated 250,000 to nearly 275,000 Axis personnel. Among them were thousands of medical professionals drawn from some of Germany's most prominent formations, including the 21st Panzer Division, the 15th Panzer Division, and the 90th Light Division. Doctors, medics, and nurses who had served at the front now found themselves abruptly transitioning from caregivers in a collapsing army to prisoners under Allied control. Although the majority of captured medical staff were men, physicians, surgeons, and orderlies, the smaller group of nurses faced a particularly jarring confrontation with realities that clashed sharply with the worldview instilled in them by National Socialist ideology. Their capture would initiate a prolonged and deeply unsettling exposure to systems and values they had been taught to dismiss or distrust. American handling of captured medical personnel adhered closely to the Geneva Convention and was notable for its speed and organization. At initial holding and collection sites around Tunis, U.S. Army medical officers conducted evaluations almost immediately. Within hours, German medical staff were classified according to Allied needs. Those deemed essential for the treatment of wounded German prisoners were temporarily retained. Others were designated for transfer out of the combat zone. By early summer 1943, the first contingents of German medical prisoners began embarkation aboard American Liberty ships bound for the United States. These standardized cargo vessels, produced in astonishing numbers, directly contradicted German claims that American industry was inefficient or overstretched. For the nurses and doctors aboard, the ships themselves became an unexpected lesson in material capacity. On-board medical facilities far exceeded anything most of them had encountered either in the field or at home. Fully equipped operating rooms were illuminated by reliable electric lighting. X-ray machines functioned without interruption. Refrigerated storage ensured the preservation of medicines that had previously spoiled under desert conditions. Particularly striking were the ample supplies of blood plasma, properly typed, carefully stored, and administered according to protocols that minimized risk. This stood in contrast to the improvised and often dangerous direct transfusions German medical units had been forced to attempt near the front.
The Atlantic crossing became a continuous demonstration of American logistical abundance. Materials that German forces rationed with extreme caution were used freely. Sulfur powder, once measured grain by grain, was applied generously. Bandages were discarded after a single use. Food was plentiful enough that leftovers were routinely thrown away. For medical personnel accustomed to chronic shortages, such waste bordered on the unimaginable. Upon arrival at ports along the American East Coast, ranging from Norfolk to New York, the prisoners encountered yet another surprise. At facilities such as the Norfolk Naval Base, processing included thorough medical examinations for all captured personnel. Dental care was provided as a matter of course. Untreated infections were addressed. Those with vision problems were issued corrective eyewear. The overall standard of care exceeded what many of these individuals knew was available to civilians inside Germany at the time.
transport by rail to inland camps offered further visual evidence that contradicted years of propaganda. Along the route, city after city revealed brightly lit hospitals and expansive medical complexes. In Richmond, the facilities of the Medical College of Virginia were visible from passing trains. In Philadelphia, large hospital buildings dominated parts of the skyline. Even smaller urban centers appeared to possess healthcare infrastructure superior to that of major German cities under wartime strain. During a stop in Washington, D.C., representatives of the American Red Cross boarded the trains to distribute aid packages to the German prisoners of war. The contents, basic toiletries, cigarettes, chocolate, writing paper, and envelopes, were modest by American standards, but deeply unsettling to recipients who had been conditioned to expect hostility or neglect. For German nurses shaped by doctrines emphasizing racial struggle and the dehumanization of enemies, this treatment proved especially difficult to reconcile. The consistency of humane conduct extended even to those who had fought for the Reich, challenged assumptions that at once seemed unquestionable. Camp Opelika, Alabama, established in September 1942, became one of the destinations for these captured medical personnel. When the first nurses and doctors from the Africa Corps arrived there in June 1943, their journey from the deserts of North Africa to the American South had already transformed their understanding of the war, the enemy, and the world beyond the ideology they had been taught to accept without doubt.
During the Second World War, an extraordinary medical experiment unfolded inside American prisoner of war camps, one that had no precedent in modern warfare. Within these hospitals, physicians and nurses trained under Nazi racial ideology found themselves working inside a medical system built on entirely different principles. German medical personnel, educated to view medicine as a tool for racial engineering, were placed alongside American doctors who practiced evidence-based clinical care. This coexistence was mandated by the Geneva Convention, which allowed enemy medical staff to treat their own wounded under Allied supervision. Under this arrangement, American military physicians maintained authority over medical policy and standards, while German doctors and nurses carried out hands-on patient care. The result was an unprecedented scenario: enemy medical professionals operating within and subject to the protocols of the United States Medical Corps. For many Germans, the experience was both shocking and transformative. The physical environment alone was enough to upend expectations. German nurses were stunned by the scale and sophistication of American hospital infrastructure. Surgical theaters were equipped with adjustable electric lighting, modern cauterization devices, and autoclaves capable of sterilizing instruments in minutes rather than hours. Much of this technology had been familiar to them only in theory, described in textbooks but rarely seen in practice. The hospital pharmacies were equally astonishing, stocked with hundreds of medications stored under climate-controlled conditions, clearly labeled and dated years into the future. On July 21, 1944, Glidden General Hospital in Okmulgee, Oklahoma, was officially redesignated as the first German prisoner of war general hospital in the United States. With a capacity of 1,690 beds, it operated using a dual medical structure, parallel American and German teams working within a single system. Colonel Henry W. Misch, the hospital's commanding officer, instituted a policy that would have been unthinkable in Nazi Germany: integrated medical collaboration across enemy lines with shared procedures, oversight, and clinical standards. German nurses, many trained through National Socialist nursing programs that portrayed American medicine as inferior and morally corrupted, were confronted with a reality that contradicted everything they had been taught. Instead of ideological improvisation, they observed a system grounded in systematic research, standardized protocols, and continuous evaluation of outcomes. Particularly destabilizing to their worldview was the presence of African American nurses assigned to prisoner wards.
Due to racial segregation within the U.S. military, black nurses were often barred from caring for white American soldiers and were instead assigned to enemy prisoners. For German nurses steeped in Nazi racial doctrine, the sight was profoundly unsettling. These African American professionals demonstrated technical expertise, discipline, and compassion that directly contradicted the racial hierarchies they had been indoctrinated to believe were biologically fixed. The contradiction was impossible to ignore. Nothing, however, illustrated the gap between American and German medicine more vividly than antibiotics, specifically penicillin. In 1943, the United States had already produced 21 billion units of the drug. By 1945, production had exploded to approximately 6.8 trillion units. German medical personnel who had worked throughout the war with little to no access to effective antibiotics witnessed its routine application with disbelief. At Camp Forest in Tennessee, another major POW facility with extensive medical services, German nurses observed infections resolve in days that would have been fatal in German field hospitals. Conditions that once necessitated amputation were treated conservatively, preserving limbs and lives alike. For many, this was not merely a technological revelation, but a philosophical one. American physicians, many of them civilian doctors temporarily in uniform, openly shared medical knowledge with enemy staff. This transparency ran counter to everything German medical personnel had learned about secrecy, hierarchy, and the role of medicine in war. Blood transfusion practices represented yet another area in which American medicine was far ahead. German forces still relied heavily on direct transfusions, a method that frequently caused fatal reactions. In contrast, the U.S. military had developed an industrial-scale blood plasma system based on proper typing, cross-matching, preservation, and long-distance transport. At hospitals such as the 21st General Hospital in Ravenel, France, where captured German medical staff began working in December 1944, plasma could be stored for months, shipped across continents, and administered safely without knowing the recipient's blood type. These capabilities were beyond anything German military medicine had achieved. The ideological contrast was as stark as the technological one. German nurses educated in National Socialist programs had been taught that medicine existed to serve racial purification. Their curriculum included heredity theory and racial biology, emphasizing the elimination of the weak for the supposed benefit of the collective. Yet in American-run hospitals, including massive facilities like the 12th Field Hospital with its 30,000-bed operations, they witnessed the opposite principle in action. German prisoners received the same surgical care, medications, and nursing attention as American wounded soldiers. Scarce resources were not withheld based on nationality. Enemies were treated not as biological threats, but as patients. This insistence on equal care, medicine as a universal human obligation rather than an ideological weapon, slowly eroded the foundations of Nazi medical belief. For many German medical professionals, the experience did not merely challenge their assumptions, it dismantled them. Inside these hospitals, far from the battlefield, the war over ideas was being quietly but decisively lost. Christmas in 1943 became a turning point that few German prisoners of war could have anticipated. Across the United States, civilian aid groups organized an unprecedented humanitarian effort, distributing nearly 500,000 care packages to captured German soldiers. Inside each parcel were items that had long vanished from daily life in wartime Europe: ground coffee, chocolate bars, cigarettes, soap, and other small comforts that now carried enormous symbolic weight. At Camp Alva in Oklahoma, a facility designated primarily for former Africa Corps personnel, the holiday season unfolded in a manner entirely alien to the prisoners' expectations. Local churches arranged performances of traditional German Christmas hymns. Boy Scout troops delivered cards crafted by hand. Some American families, with sons actively fighting in Europe, contributed baked goods and homemade treats to men who had once worn the enemy's uniform. The Christmas meal itself was staggering: turkey, ham, fresh vegetables, and an array of desserts that exceeded anything many German soldiers had experienced for years, even before their capture. German medical personnel, particularly nurses held as prisoners, recorded their bewilderment. They struggled to reconcile the generosity they witnessed with the image of Americans portrayed by Nazi propaganda as cruel and morally bankrupt. The contradiction was deeply unsettling: an enemy demonstrating compassion grounded in Christian ethics, while their own government preached dehumanization and hatred. By 1944, American authorities expanded these efforts beyond material aid. The Special Projects Division launched structured educational initiatives aimed at German medical staff in captivity. Nurses were enrolled in formal lecture series, some conducted in cooperation with respected institutions, such as the University of Nebraska Medical School at Fort Robinson. The subjects were transformative: medical ethics, patient autonomy, and the application of the scientific method to clinical decision-making. Equally shocking was the style of instruction. Rather than rigid obedience to authority, German nurses encountered classrooms where questioning was encouraged, debate was welcomed, and disagreement was treated as a pathway to truth. This approach directly challenged the hierarchical and authoritarian training they had known. Access to American medical journals introduced yet another revelation. Many breakthroughs credited to German science before the war had been pioneered by Jewish physicians and researchers who were later expelled or erased by the Nazi regime. For many, the psychological strain of this realization was profound. As the war drew to a close and American medical units redeployed to Europe, German nurses increasingly found themselves assigned to staff Allied military hospitals. One such example was the 45th General Hospital in Bari, Italy, which on July 31, 1945, began receiving German prisoners for treatment. Under strict American oversight, German nurses worked alongside Allied staff in facilities that treated all patients equally, regardless of nationality. Wounded Allied soldiers, Italian civilians, and German prisoners shared the same wards, resources, and standards of care. This experience forced German medical personnel to confront yet another ideological collapse. They were now applying advanced American medical techniques and pharmaceuticals to patients whom Nazi doctrine had labeled as inferior. The technological gap was impossible to ignore. Equipment that was rare or non-existent in Germany had become routine in American hospitals. X-ray imaging was standard practice. Electrocardiographs, devices many German nurses had never encountered, were commonly used. At institutions such as the 3rd Convalescent Hospital, operating between May and September 1945, German nurses received hands-on training with modern medical equipment. Autoclaves sterilized instruments in minutes instead of hours. Electric suction units replaced exhausting manual pumps. Even adjustable hospital beds, seemingly simple innovations, represented a level of efficiency and patient care they had not previously known. The most devastating reckoning arrived in the spring of 1945. German medical prisoners were shown documentary footage of liberated concentration camps. Those who had served within the Nazi medical system faced an unavoidable moral collapse. Initial disbelief gave way as evidence accumulated. Testimonies from American medical officers who had entered the camps, photographic documentation, and letters from relatives in Germany confirming the atrocities. The realization was inescapable. Medicine had been weaponized, transformed from a healing profession into an instrument of systematic murder. American officers approached this moment with deliberate professionalism. They emphasized that medicine itself was not on trial, but that it must never again be subordinated to political ideology. Healing, they insisted, could only exist where ethics were absolute. In response, U.S. authorities introduced targeted denazification programs for German medical personnel. Mandatory courses addressed democratic values and medical ethics through concrete case studies, illustrating how racialized medicine had destroyed lives, while evidence-based ethical practice preserved them. At Camp Opelika, Lieutenant Colonel Dorothy Whitman arranged for German nurses to observe American nursing procedures firsthand, highlighting meticulous documentation, patient advocacy, and accountability. The lesson was unmistakable. Technical expertise alone was insufficient. Without moral responsibility and ethical grounding, medical skill could become a tool of harm rather than healing.
During their confinement in the United States, German medical personnel encountered a reality that sharply conflicted with everything they had been taught to believe. American military hospitals operated with a level of material abundance that seemed almost unreal to them. Medications that were nearing expiration dates were routinely thrown away, even though those same drugs were scarce or entirely unavailable in wartime Germany. Medical instruments were not endlessly repaired and reused. Instead, they were replaced at the first sign of deterioration. What appeared to German observers as excess or waste was in fact evidence of a deeper industrial truth. Contrary to Nazi propaganda, the United States did not acquire its medical wealth through territorial conquest. It generated it through large-scale production, logistics, and industrial capacity. While Germany fought desperately to seize resources, America manufactured them in quantities that appeared limitless. Even more unsettling than material abundance was the American approach to nursing itself. In Nazi Germany, the medical profession operated within a rigid hierarchy that demanded obedience above all else. Nurses were expected to follow orders without question, regardless of circumstance. In contrast, American nurses functioned as independent professionals whose judgment carried real authority. They were encouraged to assess situations critically, to challenge physicians when necessary, and to recommend alternative courses of action based on patient needs. Decision-making within their professional scope was not only permitted, but expected. This model was entirely unfamiliar to German nurses and fundamentally challenged their understanding of their own role. At Glennon Hospital, Captain Helen Morrison articulated this philosophy plainly. She emphasized that responsibility for patient outcomes did not rest solely with doctors. If a nurse observed a problem, she was obligated to speak up, even if it meant confronting someone higher in rank. For German nurses accustomed to strict deference, this idea represented a radical redefinition of professional identity. Nursing was no longer passive assistance, it was active clinical responsibility. The presence of African American medical personnel intensified this ideological disruption. German nurses, shaped by years of racial indoctrination, found themselves working under black professionals whose competence, authority, and expertise were undeniable. At Camp Florence in Arizona, Lieutenant Ellen Helen Powell supervised German nursing staff with confidence and professionalism. She instructed them, corrected their techniques, and introduced improved procedures. Each interaction forced the German nurses to confront the contradiction between Nazi racial teachings and observable reality. The dissonance was impossible to ignore. There was a bitter irony embedded in this situation. Within the segregated American military system, black nurses were often assigned to care for enemy prisoners rather than white American soldiers. Yet even this deeply flawed arrangement produced medical outcomes far superior to those achieved under Nazi racial medicine. The lived experience of working under black medical leadership quietly dismantled years of ideological conditioning. Following Italy's surrender in September 1943, another contrast became visible. Italian medical personnel who demonstrated cooperation with American authorities were granted increased freedoms and improved conditions. German nurses observed former Axis allies moving with relative autonomy while they themselves remained under restriction. The distinction was not based on past allegiance, but on present behavior. This pragmatic, results-oriented approach stood in opposition to Nazi ideology, which emphasized rigid loyalty and immutable identity. Italian nurses were allowed to work freely, while German personnel who clung to Nazi beliefs continued to be closely supervised. Despite their status as prisoners, German nurses received an education that often exceeded the quality of training they had received in their own country. American officers openly shared medical knowledge without limitation.
New pharmaceuticals, advanced equipment, and innovative treatment methods were taught freely. Techniques developed in the Pacific Theater for burn care, along with surgical advancements refined in European combat zones, were introduced in detail. German nurses carefully documented everything they learned, fully aware that they would soon return to a homeland devastated by war and desperate for medical expertise. As the conflict drew to a close in May 1945, American authorities shifted their focus toward preparation for repatriation. German medical personnel were enrolled in structured training programs designed to equip them for the immense challenges awaiting them in post-war Germany. Instruction covered public health fundamentals, epidemic prevention, emergency response, and large-scale treatment of malnutrition. They were taught how to purify water supplies, organize mass vaccination campaigns, and manage medical crises with minimal resources. Colonel Richard Stevens made the purpose of this effort explicit. He explained that Germany would soon face overwhelming medical needs and that this training represented an investment in a future democratic society. Courses included guidance on establishing functional clinics amid destruction, training auxiliary staff, and implementing public health measures under extreme scarcity. Upon completion, German nurses received formal certificates recognizing their American education, credentials that proved valuable in occupied Germany. When these nurses returned between 1945 and 1946, they encountered a nation in ruins with an estimated 60% of hospitals destroyed. They carried back more than new techniques or clinical skills. They returned with a fundamentally altered philosophy of medicine, one rooted in professional autonomy, evidence-based practice, and responsibility to patient outcomes rather than ideology or hierarchy. During captivity, American medical staff introduced structured training programs for German prisoners with medical backgrounds. These programs emphasized clinical reasoning, standardized procedures, and above all, the ethical principle that patients must be treated as individuals rather than instruments of ideology. Nursing care was framed around patient advocacy, professional responsibility, and scientific evidence, concepts largely absent from wartime German medical practice. As Germany's infrastructure lay in ruins in 1945, returning prisoners carried this experience back with them. In hospitals and temporary medical facilities across the American occupation zone, former prisoners implemented practices they had learned firsthand. Blood transfusion services were reorganized using American blood banking methods. Antibiotics, previously scarce or inconsistently applied, were administered systematically according to protocols modeled on U.S. guidelines. By late 1945, when most American medical personnel had withdrawn from direct involvement in German healthcare, these American-trained German professionals became indispensable to maintaining basic public health services. The influence of this training did not fade with the immediate post-war emergency. In the years that followed, former prisoners increasingly assumed leadership roles. By the early 1950s, a significant number of nursing schools in West Germany were directed by individuals who had received medical education during captivity in the United States. These institutions introduced innovations such as formal nursing diagnoses, continuous professional education, and the expectation that nurses actively advocate for their patients rather than merely follow orders. The ripple effects extended beyond nursing education. German pharmaceutical manufacturers, exposed through returning personnel to American standards of quality control and documentation, began revising their production and testing procedures. Hospitals underwent organizational reforms modeled on systems observed in U.S. military and civilian medical facilities, emphasizing efficiency, accountability, and interdisciplinary cooperation. Quantitative evidence illustrates the scale of this transformation. Approximately 371,000 German prisoners of war were held in the United States, many of whom participated in organized medical work or instruction. More than 200 medical facilities in post-war Germany employed staff who had received training during captivity in the United States. Records document over 100,000 hours of medical education provided to prisoners, alongside hundreds of thousands of clinical procedures performed under supervision. At least 15 nursing schools were directly established or restructured by returning former prisoners, with dozens of hospitals reorganized along American institutional models within the U.S. occupation zone. The cumulative effect was substantial. Each trained nurse passed new practices and values on to colleagues. Each restructured hospital served thousands of patients annually. Over time, these changes multiplied, embedding new professional norms into the German healthcare system. Half a century later, in 1995, surviving German nurses who had experienced captivity in the United States issued a collective statement reflecting on their journey. They acknowledged their service under the Nazi regime and their subsequent status as prisoners of war. They testified that medicine distorted by ideology becomes an instrument of destruction, while medicine grounded in science and compassion preserves life. They recalled being confronted with material abundance beyond anything they had known. Ample medications, advanced technology, and sufficient resources. Yet they emphasized that the most profound lesson was not technological, but ethical. American doctors and nurses treated enemy prisoners with the same care afforded to their own citizens. Illness erased national identity. The patient came first. Upon returning home, these medical professionals carried more than technical knowledge. They brought with them a redefined understanding of healing as a universal responsibility that transcends borders, politics, and belief systems. This principle became a message they passed on to future generations of healthcare workers. Medicine must never again be subordinated to ideology. They arrived in captivity as defeated soldiers and medical auxiliaries. They departed as witnesses to a different model of care, one rooted in dignity, equality, and compassion. The experience of German nurses in American prisoner of war camps stands as one of the most consequential ideological reversals of the Second World War. What they encountered was not merely superior technology, but a clear demonstration of medicine's true purpose: to heal without discrimination. Their journey from Nazi medical servants to advocates of scientific humanitarian medicine demonstrates that experience can overpower propaganda. Daily exposure to American medical practice achieved what force never could: a complete ideological transformation. The 9 nurses who emerged from Cherbourg's underground hospital on July 2, 1944, represented thousands who would undergo the same revelation. They entered captivity believing in German racial superiority. They left understanding that medical excellence arises from science, adequate resources, and universal compassion. This became one of America's greatest medical victories, not won on the battlefield, but through daily practice. Humanitarian medicine proved superior to medicine corrupted by ideology. The German nurses were not merely captured, they were converted by witnessing medicine's true purpose. Their transformation helped lay the foundation for the reconstruction of post-war German medicine on humanitarian rather than racial principles. It stands as proof that even deeply indoctrinated minds can change when confronted with undeniable evidence of a better way. The nurses discovered that their enemies possessed not only superior resources, but a superior medical philosophy. They had been taught that medicine served racial ideology. They learned instead that medicine serves humanity. That lesson, learned in captivity, reshaped German medicine for generations. Their story remains a testament. Medicine grounded in science and compassion will always triumph over medicine corrupted by hatred and ideology. The captured became witnesses, enemies became colleagues, and through their transformation, medicine returned to its proper purpose: healing without borders,
science without prejudice, compassion for all who suffer.